us that, you're going to tell us the Revita approach.
Yes. Basically, what we make sure in the Revita is to make sure that it's not the true hormonal reason why you're having the hair loss. We look at their thyroid levels. We make sure that those are at a good level. If they're not, we pull them up. And like I said, most of the time, that's what fixes it. If it's related to testosterone, again, if it's a pre or perimenopausal woman, if it's related to testosterone, we'll know, because if the thyroid doesn't fix it, then okay, let's see what the testosterone is doing. We'll kind of make sure, hey, if it's too much testosterone, what do we need to do to try to get it down? If it's, and usually it's too much testosterone, and usually it's specifically DHT. In that situation, you really can't take DHT down. There's not really, you can't give somebody something to reduce it, okay? So you have to treat the areas where they're having the hair loss with stuff that reduces DHT, and sometimes we'll do a progesterone lotion on the head, and a progesterone solution we add some other things to it to help kind of regenerate the hair.
Regenerate, exactly, because we look at our moms and we're saying, we're not like mom, but you know what? We are.
Yeah. Eventually you are, because you got this half her genetics. So if your mom is losing her hair and later in life, and it's going to probably happen to pretty much every woman, and like I said, it's usually related to hormonal loss. That's supposed to be a natural process, but it's not really natural, because again, like I said in my previous interviews and stuff, we're not supposed to live past the age of 40. Our genetics are not set up for that, but because of our technology, we're living longer. So you're going to see these issues occur: the graying, the loss of hair in the head, gain of hair on the body too. And that's actually a telltale sign if it is testosterone. If you start noticing that you're gaining hair and you're seeing hair on your chin, and you're seeing growing a mustache, and you're a woman and you're losing hair on your head, that's probably because your testosterone is too high. Again, like I said, it's very hard to deal with, but we can get through it and find other ways to improve on it. So
before we leave out, I remember you telling me about a patient who had gray hair.
Yeah.
And her hair reversed back.
Yeah, I had two patients specifically that came and told me that. One was a male, one was a female. She didn't realize it until she went to her hairdresser, and her hairdresser, Maria, your hair is, your color's coming back, and it can do that. It can help with that.
That's amazing. Awesome. Well, we like the Revita approach, and I want to thank you for just addressing all the issues. Is there anything else? I always want to stay on the hair. Is there anything else about female hair loss that, the Revita approach that I missed asking today?
Well, the big thing is what I tell a lot of patients. It is the most frustrating thing for women is next to weight. Weight's number one. Women want to make sure that they don't gain weight with whatever they're doing, and hair loss is the second thing, because women don't want to go bald. I can't say that for myself and men, but women don't want to go bald. So what we want to do is make sure that if it starts happening, that I need my patients to let me know as soon as it starts happening. Again, it can be a struggle. It's a process. It takes time. But once we figure out what exactly is causing the issue, it's usually very simple to fix. The problem is what is causing the issue.
Right.
Okay, and before I even let you go any further, there are also chemical reasons. Like if you're putting something in your hair, I need to know that, because that could be damaging your hair as well.
Right.
So I need to know all factors of what may be causing the issue. So as much information as the patient can bring me, the more I can do for them. So.
We like the way that you talk to us, and you treat us like a real person.
Yeah. And I don't want any woman to go bald unless they're planning on wanting to go bald. So if a woman says to me, I don't want to go bald, I take that very seriously.
Maybe one day it'll come in fashion.
No, I don't expect that.
Dr. Peter Fatino's Revita Health and Wellness Show. We can go online, RevitaWellness.com. That's Revita Wellness, or RevitaMedical.com, 704-847-0011.